Hello and magandang hapon po. Kumusta po kayong lahat? Thanks for joining us today. And sa mga bago po, I'm Dr. Anna York Bondoc. And please follow us, YouTube and Facebook and now TikTok. So meron na po tayong TikTok medical videos na the first is how to use a pulse oximeter po and it has more than 700,000 views. So I'm very happy po. And mukhang magtutuloy-tuloy na tayo sa TikTok. But today, we have been very busy the whole week po kasi po ang dami talagang mga DepEd schools na kumuha po sa atin. I would like to thank the Del Carmen National High School of Lubao, Pampanga with Ma'am Saring Bona and their teaching force. I would also like to thank the San Luis National High School with Ma'am Ruby Rosa Sagum and their teaching force. And today po yung ating Alauli Elementary School in Masantol, Pampanga and the Sapang Kawayan Elementary School in Masantol, Pampanga. Because po of their katatapos lang, 9 o'clock this morning until 11, we were in the left bank of Masantol, again, educating persons po about COVID. So dahil po sa sobrang dami po ng aming DepEd commitments, medyo we have been busy and have been unable to pick up the questions na iniwan po ng mga tao. So ngayon po is question hour dito po sa ating libreng konsulta. Magpakonsulta na po kayo. Please put your questions below and we will read them po and answer them. So Reina is with us today. Miss Reina, my nurse. Reina, kumusta yung linggo mo? Have you been busy?
Hi, Doc. Good afternoon po and good afternoon po sa lahat. Yes, Doc, busy tayo for the whole week. Grabe, ang dami nating ganap. May mga estudyante na nagpasa ng mga entry na nakikinig talaga po sila. Estudyante and parents po, we would like to thank all of you for posting your pictures online and tagging us and letting us know that you are listening to us. And maraming salamat po at madami po kayong natutunan and nakipag-participate din po kayo sa amin.
Ang grabe ang usapan, Reina. Parang kanina ayaw nilang tumigil ng tanong. With our two school heads, Ma'am Rowena, Ma'am Weng, and Ma'am Winnie, thank you so much po, no? Talagang, nung last question, talagang halos tinalunan nila yung questions and we're really happy about that. That's a big, po talaga. Thank you. Kasi talagang, alam mo, maraming lectures pero there are few people who answer questions. And I really like the question hour po na ating gagawin. And another thing that was very interesting po, yung sa San Luis National High School, nagkaroon po tayo the first ever yung Dancing with Doktora. So, nag-submit po sila ng mga videos, which was really pretty cute. At nakita po natin silang sumasayaw. So, we're gonna be answering the questions. Just put them down po and basahin po natin. I will read the first question kasi hindi pa ata ready si Ma'am Kat. So, ako po, I would like to greet ito po, the 53rd anniversary of the Tau Gamma Phi Masantol Council Grand Triskelion from Marco Manansala on October 4. Inaanak ko po si Marco. Marco is my inaanak. Thank you, Marco. And laki na po, no? Okay.
Ayan na,
meron na pong first question.
Questions natin, Doktora. Okay, for our first question, medyo ayusin natin, Doktora, yung camera mo. Medyo madami tayong space sa taas. So, para lang. Yan.
Okay, sorry. Adjustments lang po.
Yes po.
Okay, thank you so much.
From one of our Facebook viewer, I would just like to inquire po, what should the parents of a special child do? Their son has a big fear of the vaccine po. So, he hasn't gotten his coronavirus vax po. What step po do they need to do for their son's protection po?
Nako, napakahirap na tanong po ito, no? And there are some special children who are above the age of 18. So talaga pong they are already eligible for their vaccine, and it would be a good idea for them to be vaccinated. Kasi syempre they have parents in the home po who also work, baka po makauwi ng virus, hindi naman ho sinasadya, no? And then magkasakit pa po yung ating special child. This is a very difficult question indeed. And honestly, I'm gonna tell you, I'm not a pediatrician. So yun na lang po, no? But again, above the age of 18 na siguro ito special child, siguro po, pwede bang paliwanagan? And then kung sakali po talaga, um, you need to be talagang ano po kasama po talaga kayo during that time. The caregiver of the child must be with them at all times when they would receive po a vaccine. One option po na pwede, no, and this is being done in Manila and other places po, no, kung pwede lang, bakunahan na po yung special child sa bahay. Okay? This is my first request. It can be done. Marami na pong nabakunahan na mga bedridden talaga, pinupuntahan po sila sa bahay. Okay? So, si special child, you can ask the barangay, why would I request that the special child be vaccinated in the house? Kasi po, biro mo, lalabas pa siya ng bahay. Ang hirap ng paliwanagan that he has to wear a mask. And then, baka mataranta pa po sa vaccination site, ang daming tao. And then, they will encounter people that he does not know. Kung sakali pong magka-problema, ang dami pa pong nanonood. I mean, it's as a parent, kakabahan ka rin. Okay? I think it's better to vaccinate at home. Relax po si special child dun sa loob po ng kwarto niya. Kasama niya yung mga magulang niya. At the most po na makikita niya, isang tao lang po na magbabakuna. So ako po, that is my best advice is to vaccinate the special child at home. And then number 2 po is the issue of consent. Sino po ba ang pipirma para kay special child? That will most likely po be the parents. So, hindi po pwedeng pumirma si special child, especially if he's really not understanding too much. So, kailangan po yung trusted guardian po ay nandoon. But yes, I would suggest po na pabakunahan si special child kasi hindi naman po pwedeng for the next 5 years nasa bahay lang po yung special child, especially if he's above the age of 18. And number 2 po, no, if they go out of the house, baka hindi niya po maintindihan that he has to wear a mask the whole time. So, those are my suggestions po. And of course, I'm not a pediatrician. Ako po ang unang aamin sa inyo, hindi ako pedia. Consult din po yung inyong pediatrician. Okay, Reyna, ikaw, any thoughts? Ang hirap nung tanong, honestly.
The question is as special as the child, no? Ako agree.
Totoo.
Napakaganda ng idea nyo po na sana po magkaroon tayo ng, I think meron naman sa iba, no?
Merong nagbabakuna sa bahay.
Na yes, ako I'd like to have that idea na siguro kasimulaan na ito ng mga barangay chairman, mag-survey na sila sa mga bahay-bahay kung ilan ang mga special child sa nasasakupan nila. Idamay na din nila yung mga PWD at saka mga senior. Yun lang po ang thoughts ko. I would agree with you, definitely, Doktor. Napakaganda po ng inyong suggestion and remark po.
Okay. Thank you so much. Ang ganda po ng tanong. Ako po, tinamaan din po sa tanong na yon. Thank you for asking that question.
I hope pati PWD, no, Doktora, no, meron nang magpupunta.
Kung pwede po talaga. Actually, my husband mentioned this to me. Dapat daw siguro daw na A3 yung PWD. Pero actually, hindi naman kasi for example, you are in a wheelchair. It does not really make you more immune. Pero ano na lang, if kung pwede sa bahay na lang sila bakunahan. Kung hindi naman pwede, sana may special lane. Okay?
Yes, for the convenience. Kasi kawawa.
For the convenience. Kasi kawawa rin po sila.
Yes, pati mga buntis, Dok. Sobrang, pag binabalita ko sa mga kakilala kong co-nurses ko, yung inyo pong ginawa sa San Luis na puro buntis lang muna ang inasikaso for bakuna. Ay, ang ganda daw pong idea nun. Kasi, Dok, napakahirap pumila para sa isang buntis, tas nakatakip ka pa ng di ba?
So, yeah, you have a mask, you have a face shield, then you have to keep going to the CR para umihi. Ay, nako.
Yes. So, napakaganda po nung idea. Sana madaming gumaya po nung idea.
Yes, buntis vaccination day po. It is safe. Second trimester po ang mga regular mommies. Frontliner mommies po, pwede po sa first trimester. So please get yourself vaccinated kasi ang hirap pong umiri na positive, ano?
Tama, Dok. At saka kawawa yung mga
Matatakot pa ho sa inyo. Siyempre, of course, they will help you, ano. Pero siyempre, may nervous din po naman yung nurse na kasama nyo. I mean, it's still better to be not positive pag nanganganak. Okay? And sabi nga nila, bakunado na mommy, pati si baby, protektado. Ayan. Buntis na
Yes.
bakunado, pati si baby, protektado. Okay, next
Opo.
question na po.
Another question. Hello po, Doktora. Ask ko lang po kung ang isang tao na dating nag-positive sa COVID, then gumaling na is pwede na magpa-vaccine ng anti-COVID? Or may duration pa po ba? Thanks po, Doktora, and God bless you.
Ganda po ng tanong na ito. This was sent via Facebook dun sa atin pong Dr. Anna York Bondoc. Thank you, no? Yes, ang mga taong nagkaroon ng COVID, pwede pong bakunahan. How soon, ano? First of all, dapat tapos na po yung kanilang 14 days of isolation and quarantine. So, hindi po pwede sa gitna ng isolation nyo pupunta kayo doon dahil maganda yung pakiramdam nyo. No, you have to finish the 14 days kasi baka kayo magkalat pa ng COVID doon sa vaccination site. Okay? Number 2, after the 14 days po na quarantine, kailangan po at least 3 days na wala na po kayong lagnat at wala talaga kayong nararamdaman. Super okay na kayo. As soon as that happens, you can get vaccinated. Dati po, sinasabi po nila 90 days. Pero ngayon po, as long as tapos ng quarantine and you feel okay, then you can get vaccinated. So kahit po na nagkaroon kayo ng positive, please get yourself vaccinated kasi yung antibodies po ng bakuna is stronger and more long-lasting. No? Mas tumatagal kaysa sa antibody po ng nakukuha po pag nagkaroon po ng COVID infection. Okay?
Okay. Next po. Magtatanong lang po sana ako. Yung nanay ko po kasi asthmatic. Recently po, madalas siyang sumpungin ng asthma niya. 4 to 5 times a day pag nagne-nebulizer siya. Ano po ang dapat gawin? Matagal na rin po kasi siya di nagkakapagpa-check up. Salamat po sa sagot.
Oo nga. You know, this is a big, ang napipick up ko dito is not only the asthma question, pero tinamaan ako nung last line, matagal na po siyang hindi nagpapa-check up. And this is really happening ngayon. Ang dami po talagang mga tao na natatakot pong magpa-check up. Lalo na sa opisina ng doktor. Worse kung yung opisina ng doktor located pa po sa loob ng ospital, like St. Luke's, Medical City, nandun ho sa complex ng ospital yung yung clinic ng doktor. So talaga nagkaka-nervous po yung mga taong pumunta doon. What I could say po is, hindi naman siya perfect, but the hospital and the doctors are forever disinfecting their office. Nag-iingat din po sila. Bumili rin po sila ng mga HEPA filters, mga PPEs to make their offices safe. Okay? So safe naman po sa opisina ng doktor. At saka po siniscreen po lahat po ng papasok. Okay? Kung ayaw nyo pong maghintay ng matagal na maraming tao, kasi kung minsan, di ba, may pila, pwede nyo naman hong iwanan yung cellphone number nyo dun sa secretary at sabihin, pakitext na lang pag malapit na kami. And then, you just sit po in your car or sa labas ng, kung wala kayong car, sa labas po ng ospital, tumambay ho muna sa mga open air. And then, pagdating po ng text, pumasok na po kayo dun po sa opisina ng doktor. Again, mas masama pa po yung hindi magpapa-check up kasi baka may nangyayari na po dyan, hindi nyo po napapansin or baka ho, kailangan nyo na ng mas maraming gamot like si mommy, parang napapadalas na po yung kanyang asthma attacks. So my best answer to this, imbes na mag-prescribe ako dito over the internet, my best answer po, go to the doctor and check up. While you're going, wear a mask. Kung talagang hindi nyo kaya, magpa-telemedicine na lang po. Okay? Pwede naman. Marami na hong doktor sa internet. Yung sa amin, libre lang.
Hello po.
Huwag nyo na
Hello
pong
po.
basahin yung pangalan. Oo.
Okay, hello po, Dr. Anna. I'm from Pangasinan po. Napanood ko po kayo sa DZMM Teleradyo kahapon at di po ako nagkaroon ng pagkakataong makapagtanong. May question po sana ako sa inyo, mild symptoms ay ilang araw po ba bago siya pwede magpa-COVID vaccine? Salamat po, Doktora.
Maganda rin ito, no? Kasi some people think na dahil mild lang, ganon, If you do have symptoms of COVID, ano, lalo na kung hindi naman kayo nagpa-test, paki-take down lang ng question. Lalo na pag hindi po kayo nagpa-test, ano, but you do have symptoms, ang advice ko po sa inyo, still quarantine yourself for at least 14 days. Kasi due to the Delta, talagang ginawa na po nila talagang saktong 14 days. Kasi kung pumila rin naman ho kayo dun sa vaccination site, ang unang tanong is, sinisipon ba kayo? Inuubo ba kayo? Kayo po ba ay linalagnat? Kung meron yung sagot na gano'n, you will not be allowed inside at maka-quarantine pa kayo. So kung meron kayong symptoms na gano'n, kahit nag-test o hindi nag-test, or even if you tested negative, basta may nararamdaman, wag na po kayong pumunta and magpalipas ng 14 days and then go for your vaccine. Okay? Di kayo makakapasok.
From one of our viewers, Doktora, yun po bang gamot na losartan, 50 milligrams, pwedeng palitan ng amlodipine, 5 milligrams or 10 milligrams para sa BP?
Alam mo, this is a very good question also. Not good because I can answer it, but good because, ma'am, yung internet po at saka yung mga advices po natin, pangkalahatan lang po yan. Kung bibigay po kami na reseta sa inyo, we have to know your history, ano po yung mga gamot na ininom nyo, yung physical exam nyo, and bakit nyo gustong palitan yung losartan to amlodipine, okay? Both of them are good drugs for blood pressure. Pero there are some drugs na mas bagay sa iba't ibang mga sitwasyon po, okay? So my best advice to you, sino po ang nag-prescribe ng losartan, balikan nyo na lang po yon and explain nyo po kung bakit po kayo gustong maglipat sa amlodipine. Okay? Mahirap po, don't ask the internet, do not ask the Facebook group, do not even ask me kasi kailangan po talagang intindihin po yung kaso nyo ng mabuti before we can give you advice. Okay?
Good day, Doc.
Pasensya na po, but it's for everybody's safety. Okay?
Good day, Doc. Ano po ang cause ng shingles? Anak ko po kasi mayroon yan ngayon. She's 13 years old and the girl. Ano po ang mabisang gamot para sa shingles?
Ma'am, ang tanong ko, are you sure that your anak has shingles? And thank you for asking this. Kasi po, ang shingles is usually, hindi ko naman sinabing hindi pwede. But usually, ang shingles po ay lumalabas in older adults who are immunocompromised. Okay? Anong meaning nun? Okay. At saka ano ba meaning na older adults? At ano ba yung shingles? O sige. Ang shingles po is called herpes zoster. Ito po yung mga butlig-butlig na po, it's a rash, And it comes out po sa katawan natin in one area. Halimbawa po, bumabandang ganon, it follows the nerve basically. At ano po yun? Yun po yung dating chickenpox po nung bata. Nagtago po dun sa ugat, nerve ng tao. And ngayon po, dahil po healthy kayo, maganda po immune system nyo, nalalabanan po ng katawan nyo yung nakatagong chickenpox virus. So come the time na tumanda kayo, or for example, bumaba ang immunity, anong meaning nun? Naoperahan kayo, na chemotherapy kayo, yung mga ganun po. No? Something happened that your immunity went down. Lilitaw, parang hindi na humakontrol ng katawan nyo yung shingles na yon or yung chickenpox virus na yon. And lilitaw po siya, but not as a chickenpox, as a rash po. Napakasakit po nito. If this child is 13 years old, my first question to you is, be sure po talaga na shingles or herpes zoster yon. How will you be sure? Again, patingin po sa doktor kasi may rash po talaga yan. That's very characteristic at saka masakit po yon. If indeed your daughter has shingles, my best question is next. Ba't siya nagka-shingles ang bata pa niya? So you might investigate kung bakit po siya immunocompromised. Baka po diabetic. That's another issue also. So, yun po yun. My best advice to you is find out po muna kung talagang herpes zoster or shingles po yun. And then, your doctor will discuss with you yung reason kung bakit. And number 3, may gamot po doon. Okay?
Ano po ang magandang vitamins? Salamat po.
Ako po, I am not a believer in vitamins. Hindi po ako yung type na mag-prescribe na maraming vitamins. In fact, I personally do not take vitamins. Yung anak ko rin, hindi nga masyadong ma-vitamins, parati ko nakakalimutan. And yung asawa ko kumikinsan, uminom ng Centrum. I don't want to mention brands, hindi naman sa ganon. Ako, I believe in the power of food eh. Kung tama po yung kinakain yung pagkain, there's really no need to take vitamins. Pero meron pong ibang tao na talagang gustong-gusto ng vitamina kahit po kumakain naman ng okay. In that case, I would suggest isang vitamina lang, hawag marami. Kasi nakaka-confuse, madami ko nakikitang pasyente, 6 ang bitamina, tuloy nakalimutan tuloy yung pang high blood at nakalimutan na po yung pang sugar. Tuloy ay yung BP nila ay 160 at yung asukal nila 400. Pero sagana sila sa bitamina, hindi po tama yan. Okay? So if you want to take a vitamin, just take one. Kung ayaw nyo po mag-vitamina, that's also okay. Just eat properly.
From Izari Cruz Larin, ano po ang pinagkaiba ng amnesia at dementia?
Ganda. First of all, these are two different things, ano? And amnesia, puntahan po natin, ano? Amnesia, yun po yung nakakalimot, parang it can happen with a stroke. People lose a short-term memory or long-term memory. Or kung minsan narinig natin, nakalimutan lahat. That is amnesia, okay? It usually happens due to a stroke or other po brain diseases. Ang dementia naman po, and the spelling is D-E-M-E-N-T-I-A. Pero yung pronunciation is like amnesia, dementia. Okay? Dementia, actually. Ang dementia naman po is an organic illness po of the brain kung saan po tayo nagiging makakalimutin. We lose our memory. Sometimes we forget who we are and talagang we lose our ability to make decisions, ability to function, ability to recognize persons. So may amnesia rin ho sa dementia. Okay? There are many causes of dementia. Some of them are due to small strokes din po all over the brain. Yun po yun. There are also diseases na umuwi po sa dementia that includes Parkinson's po and other forms of neurologic illnesses. Alzheimer's is a form of dementia. And meron po tayong frontal lobe diseases din po that can cause dementia. So malungkot po ang dementia, especially for the relatives who have to care for a patient na wala na po sa kanyang sarili, na wala po yung kanyang personality, na wala po yung kanyang education, na wala po yung kanyang mood, na wala po yung kanyang pag-aalala. And one of the most prominent persons who died of Alzheimer's was actually former President Ronald Reagan. At inilagaan po siya ng asawa niya until the very end. So malungkot po ito. It's very difficult for the family and very difficult for caregivers. Kasi talagang parang kahit asawa niyo na ho, you don't even recognize possibility pang parang nagiging bumabalik po sa pagkabata. Or sometimes they get violent. It is actually very sad to see a treasured parent, to see a treasured partner na mauwi po sa dementia. Malungkot po. And again, wala pa po tayong masyadong magagandang gamot to prevent these forms of Alzheimer's, dementia, and late manifestations po ng iba't iba pong neurologic illnesses. Malungkot po ito.
From Ms. Cheryl M. Mapile.
Ay, wait Reina, question. Have you ever worked in a neuro ward na kung minsan malungkot talaga, there are people due to strokes, gano'n na talagang wala sa sarili and it's really sad. Ikaw?
Doktora, na-assign ako sa dyan sa may Mandaluyong, MCNH. Yes, nadaanan ko from hanggang chronic to schizophrenic. Doktora, it is the most saddest and horrific. I say horrific kasi the stories are really
talagang yung pasyente hindi na nila alam talaga ang kawawa talaga yung pamilya po.
Ito pa, Doc, if the schizophrenic victim is a victim of a rape or a murder or something na nabuhay po sila, napaka-horrifying ng story kasi we do psychiatric nursing sa kanila. So we attend to them. The psychiatrists only attend to them at some certain point of time, but we are the ones who cares for them.
Yung sa araw-araw, mabigat.
Yes,
mabigat sa pamilya. yung pasyente wala na talaga sa kanyang tamang kaisipan eh. But it's the family who also suffers sa mga situations na ganito po.
And it's not, it's not a joke.
At saka magastos pa.
Yeah, you will see patient, doktora, that they're acting like a dog, that they're acting like
Oo
an
po.
animal. Because that's
Mahirap
what their perceptions are. Wala na silang identity. Wala na po talaga. So,
po.
napakahirap, masakit. That experience really traumatized me at tumatak talaga siya sa utak ko. Na alagaan mo ang mental health mo kasi hindi mo kakayanin na makita ang pamilya mo na nagsasuffer. Iniisip ka. Plus, ikaw din hindi mo kakayanin ng pamilya mo na i-enter mo sa isang institution. Masaklap po. Masaklap. Ingatan po ninyo ang inyong mental health. Sobra po. Katulad ng pag-iingat niyo po sa physical health, mental health po pag-ingatan niyo. Kasi
Okay.
doktora, it's not di ba? It's not a common scenario o scenery sa isang ospital ang mental institution, di ba po?
Well, some of our mental health problems do end up to become dementia patients also. But a lot of dementia can be caused by stroke po talaga. And sometimes we may not even know this. Nagugulat na lang po kami, pag scan po namin ng ulo, ang daming maliliit na strokes, kaya pala nagiging ulyanin. So there are reasons for that talaga. It's difficult, yun na lang. Tama po si Ma'am Reyna, it's difficult. Okay?
Yes po. Okay, next po. From Miss Cheryl M. Mapile, patanong po kung ang bata is 9 years old, pwede po ba siyang uminom ng saline syrup na twice a day po para ma-boost po ang immune system niya, doktora?
Ano po ang silin? I am not familiar. I'm sorry, I'm not a pediatrician eh.
It's a
Ako, ang best
vitamin.
advice ko, eat properly. Yung anak ko nga doesn't want to eat vegetables and I'm sad about that. If you want to give your kid the vitamins, wala naman pong masama.
Ako din sad. Ayaw din nila kumain ng vegetables. I don't know.
Ay, Diyos ko.
Nasa peak
Talaga.
talaga
Sige, Ma'am
tayo.
Zari.
From Miss Zari Cruz, Darin, ang tao pong nahihirapan sa paghinga, pero hindi naman po hinihika. Dapat po bang gamitan ng nebulizer?
Pwede naman po. Actually, first of all, the most important thing is, bakit po nahihirapan huminga ang isang tao? There are usually two reasons, lungs and heart. Kung heart po yun, kahit ano nebulize natin, walang maitutulong yon. So I think, Ma'am Zari, the best thing to do is to find out first, nahahapo ka ba because you have coronary artery disease? You might have a congestive heart failure. Pwede rin pong kidney problems. That's why you're retaining water. So basically, the issue is find out first why the person nahirapan huminga, kidney, heart, lung. Pero usually heart and lung. Kasi yung kidney affects the heart, kaya heart pa rin. Okay? So don't just nebulize kasi you might be nebulizing coronary artery disease, wala pong maitutulong yon. So basically, investigate the cause. Iyon po.
Okay. Good PM po, Doc. Magtatanong lang po sana ako. Pwede po bang uminom na ako ng paracetamol ngayong gabi kung ang bakuna ko po ay bukas? Baka po kasi di kayanin ng katawan ko ang vaccine. Salamat po.
Marami nagtatanong yan eh. Ako, I don't like to wala naman hong uminom ka ng paracetamol para hindi tumaas ang lagnat mo eh. I think you should just get vaccinated and then wait. Kung tumataas po, then take the paracetamol. Kasi wala naman ho talagang preventive, pero maraming gumagawa niya, aminin ko sa iyo. But my best advice is just wait na lang, baka isa ka dun sa wala mang lagnat. Okay? And if you're gonna be vaccinated with Sinovac, super konti lang po ang side effects talaga ng Sinovac, you might not even need the paracetamol. Okay?
Okay. From Ms. Anjo X. Savina. Dr. Bondoc, good day po. Need po ba magpa-check up muna ako before po ako magpa-vaccine? I'm type 2 diabetic person since 2013.
Thank you for this question. And lots of people are asking, kailangan bang magpa-clearance? Kailangan bang magpa-check up bago magpabakuna? Advice ko po lang sa inyo, if you're okay naman and you feel well, wala namang reason na kailangan ma-clear po kayo ng doktor. Ano po? There is really no reason. Pero kung gusto naman magpa-check up, wala naman din pong masama doon. But it is not required. Sa most sa amin sa province, ano, yung MHO po namin, which is called the Municipal Health Officer, or merong rural health officers, nandun po mismo sa bakuna site. So you will actually get check up there also kasi they will take your blood pressure po and then tatanungin rin kung sinisipon, like sinabi ko, inuubo, tinalagnat, gano'n. So parang may mini check up na rin po dun eh. So my answer is no need for checkup if you're okay. If you want to have a checkup, that's okay. At kung hindi rin ho kayo nag-check up, dun sa vaccination site may mga doktor. So thanks for that question. So don't panic. Hindi po kailangan na may hawak-hawak kayong clearance. Hindi po ganun. Basta may reseta kayo or some ano po na kayo po ay A3, mauna po kayo and you can get vaccinated.
From Mr. Jason Silaran, Hi Doc, good day po. Kamusta? Ask ko lang yung study about blood type O. If mas mababa po ba ang severity ng COVID-19 sa kanila? And then, pwede po kaya akong magpa-second dose kung late na ng almost 1 month? Salamat po, Doc.
Jason, thanks for this. Jason ba? Kapangalan pa ng asawa ko
Yes.
and kaspelling pa ng pangalan. Thank you, Sir Jason. So, first question. Blood type, wala pa kung ano na mas okay yung blood types sa COVID. There is no definite correlation po na kung blood type O ka, wag ka nang mag-mask, ganon. Wala. Not yet. Kung sakali man, very early and it's not yet proven. Second question, kung na-delay po yung second dose, pumunta na po kayo bukas, magpa-second dose na kayo. It's okay. Of course, I cannot suggest na magpa-delay, ano, pero may mga tao po who traveled, some people who got sick. Pwede naman po, ano, there's no need, as sasabihin ko lang ha, there is no need to repeat the first dose. Just diretso na po kayo sa second dose and okay na po kayo. And you need to have the second dose, ha? May nagtanong sa akin kanina, pwede ho bang first dose na lang kasi nininervyos? Huwag kayong mag-stop po sa first dose. So, okay naman ho, at least may first dose, ano? But 70% pa AstraZeneca first dose. So, kung gusto niyo pong abutin yung 90% protection, you really need the second dose. Okay? Ay, wait lang ha. Ang Johnson & Johnson, 1 dose lang yon. So, do not come back for the second dose. The rest of the bakuna, 2 doses.
Okay. From Ms. Edith Pangan Soriano. Doc, ano po kaya ang dahilan ng mga nag-positive pero sa awa po ng Diyos, kahit katiting na symptoms walang nararamdaman? Kaya lang naman po nagpa-swab test dahil nabalitaan na may nakasalamuhang nag-positive pero mild lang.
I'm happy to know po na mild lang po talaga yung nararamdaman. Bakunado po ba kayo? That might be one of the reasons. But again, no, kahit na mild pa ho rin symptoms, you still have to isolate and quarantine. So I'm hoping po hanggang matapos yung 14 days nyo, mild pa rin kayo. Okay?
Okay. Next po. From Ms. Cheryl Ann M. Mapile. Doc, sa 9 years old na bata, pwede po bang pabakunahan ng anti-flu at anti-pneumonia? Since hindi pa naman pwede para sa anti-COVID ang mga 9 years old po.
Tama po yun. Is this Ma'am Cheryl? Yung anak ko po is 9. Pinabakuna ko sa flu. There's actually no need sa pneumonia, but then again, I'm not a pediatrician, so consult your pediatrician. And tama po, we are not yet vaccinating kids po sa Pilipinas. So, counsel po, no, paglalabas po yung 9 years old, always wear a mask. Kahit bata po, nakakaintindi na po sila ngayon. And a face shield.
From Ms. Rowena Ibanez, ano pong pwedeng inumin kung matagal na yung ubo? Hindi naman po nilalagnat. Okay naman po yung x-ray ng kapatid ko. 2 weeks na yung ubo niya. At ano po magandang gawin? Salamat po. God bless po.
Sa bagay, 2 weeks na ito, actually, this person needs to quarantine po, ano? Lalo na po kung the cough just happened at kung meron pong ubot sipon, this person needs to quarantine. And then, second issue, kung natapos na po yung 14 days, inuubo pa, she needs to quarantine more. Opo. You can also take po mga over-the-counter po na mga ubo. cough preparations like lagundi, yung mga ganun po. And again, if you're not getting better, telemedicine po talaga kailangan nila. Kasi baka ho may asthmatic component na po yan. So basically, you need to have a doctor look at you. Pero ito lang sa panahon po ng COVID ngayon, inuubo ka, your x-ray is normal, you still need to quarantine unless, lalo na po kung dumadami na po, halimbawa, dalawa na kayong inuubo sa bahay nyo, you still need to quarantine kasi um, mahirap talaga. Nobody can say ngayon kung ubo lang yan or kung COVID na po. So,
Doc,
mahirap po talaga. It's difficult. It is difficult. Opo. Sige po.
from Miss Cheryl M. Apile, Doc, sa taong schizophrenic, may chance pa po bang makarecover at magamot po siya?
Yes, actually, Cheryl, I think that for this is not actually to recover, but to live a productive life po. There are many people who have been treated po by a combination of therapy and medication who went on po to lead very active lives. So, and with much support po from their family. So, yes, it is a scary diagnosis, pero iba na po ang mga panahon ngayon. There are a lot of new things coming out po dito. So it is not a death sentence no nakakabigla rin ho talaga, but marami hong nakakapag-asawa, nakakapagtrabaho, nakakapagpalaki po ng pamilya, and but they do need close supervision po with their psychiatrist.
From Miss Anna Jane Masangkay, normal lang po yung malapit na magmenopause. 51-year-old po. Bago po mag-mens, giniginaw at nanlalambot. Then nawawala naman after menstruation. Di na regular monthly dumarating. Thank you po. Avid fan from Colgante, Akali.
Ma'am, unfortunately, I'm not an OB-GYN, so I'm really not an expert on this. And so, yun po, I guess it happens. Kaya lang, ang hirap ko pong ang hirap kong magdadakdak about things that is not my specialty. Best advice, obigay ni ma'am. Pasyensya na po, and thank you dun sa mga nanonood from Kalantipe. Ma'am, tanong na lang po kayo about ubot sipon expert. Pasyensya na, pasyensya na.
This is our last question, Doktora, from Mizari Cruz Larin. Kapag po ba may COVID, dapat po ba na kontrolado ang carbohydrates intake?
Okay, maganda yung tinuldok ni Ma'am Zari na I think this is something to do with the link between COVID and obesity Okay? At least yun ang nakuha ko doon sa tanong it's true na if you are overweight and obese, yung risk mo for COVID would become risk for serious COVID. Yung pwede kang ma-ICU, pwede kang ma-hospital, and nakakatakot nga hong sabihin, possible pa rin pong namatay, lalo na po sa mga bata. Pero, this is what I would say, kung kayo po ay na-COVID at kayo po ay matabang-mataba, this is not the time to start the diet. Ang talaga, relax lang po, just try to eat moderately and normally. And then, after po you recover, and I'm praying that you would recover, dun po natin pag-usapan yung mga restricting po yung carbohydrate intake. While you are sick with COVID, I would suggest po that you eat freely. Huwag naman yung lumamon, But yung lang, vegetables, protein, rice, konti lang, fruits, water, some, lots of fluid, ganun po yon. Later on, if you are an obese person, that's the time po that we talk about carbohydrates, dieting. I don't like to use the word diet Proper nutrition is probably the better word po, no? So habang may COVID, wag po tayong ang taba-taba mo baka mamatay ka, positive ka, wag ka nang kumain. No, baka mag-away lang kayo for the 14 days. So I would suggest for the 14 days kung mataba man yung tao, just the regular na matinong kainin. And then later on, kung mag-survive po, and thanks God naman sana mag-survive, doon na natin puntahan yung iba. Okay? Kasi parang nakaka-stress naman, doon ka na positive, doon ka pa babawasan ng pagkain. Wag naman.
That's all, Doctora, that we have for today po.
So, thank you so much. Again, apologies sa mga pediatric questions. Diyos ko, hindi po ako pediatrician. Apologies also for the OB-GYN question. Hindi po talaga ako OB-GYN. But if you ask me about internal medicine, lungs, pulmonary, COVID, yun po talaga yung kaalaman ko. I do know a lot about mental health because I am a psychologist also. And I'm also a mental health mentor. So sa inyo po lahat, thanks so much. I'm sorry I wasn't able to go on so many lives this week. Pero babawi po tayo. Okay? Salamat po.